45 minutes just given attention. This is an extremely important topic for all of us. We all, I think, because of the recent social media event or recent updates on the social media, you all are aware that recently there was one incident about one orthopedic surgeon was in the gym and he had a cardiac arrest, and he was my gym buddy. We used to be in the gym since last 1.5 years together, and every morning, and I was with him. Just because that gym has got an AED machine, working AED machine at that time, I started CPR on him. We got an AED machine immediately because it was just next to us, and we delivered 3 shots as per the machine suggested, and he regained his rhythm. We could shift him immediately to the next door hospital, and he is absolutely alright right now. So this event is a landmark event that, in a one sense, if you know the CPR, you can save somebody's life, and that is proved again and again. This happened recently. This happened to me. I could save that person. So it has been very popular among the people who know both of us. But there are many people who are trained in this, are saving people's life very regularly. So number one myth in everybody's mind is that even if we know the CPR, वो बचेगा कि नहीं मेरे को मालूम नहीं. So just don't think that this lecture is just a lecture. This lecture is a life or death for somebody. If you know this properly, if you can deliver this properly, you can really make somebody's life, and you can make somebody alive at that particular moment. Now I have a couple of disclaimers before we go ahead. I have a habit of slightly strict teacher, and I am teaching this, and I believe that this topic is very important. So I really don't like if somebody is on mobile. Number 2, there will be a question answers, which will be questions by you, answers by me first after the lecture. Number 3, after the question answer is done, questions by me and answer by you. And if people are not able to give answer, they are going to stay here for the dinner also. And I am not going to leave you unless and until you give me correct answers. One more thing. If you don't do hands-on training today, you are not going to leave this hall. So please, all the organizers, lock the room, lock the door. Nobody is going to go home. If you don't do CPR hands-on yourself, you are not going to go home. So if you want to go home early, please keep your attention and do everything fast. All right. Let us start with the learning now. Sure. स्टार्टिंग में पेशेंट को अभी उठ नहीं रहा है. चलो भाई करो. Right. So what we are teaching right now is a combination of basic cardiac life support and compression only life support. Now, why I am teaching these two things together? Compression only life support, that is called COLS. If you want to understand COLS, compression only life support is generally done when you are outside the hospital or a clinic where you don't have anything else. Then your 2 hands. So only your 2 hands can make the magic. That is called compression only life support. And all the doctors, paramedical staff, dental, and everybody who are connected with the medical science, they should be knowing certain things which comes into the category of basic cardiac life support. Basic cardiac life support. Now, when we are dealing with the basic cardiac life support, we are trying to learn this protocol, which are developed by the group of anesthesiologists. This is the anesthesia department across the India, which is called Indian Society of Anesthesiologists, has devised Indian guidelines. So far, we used to know that American Heart Association and their guidelines were very widely popular, but our Indian scenarios are different. So Indian people have devised the system, and which is called via IRC, that is Indian Resuscitation Society, which is widely recognized across the association, including cardiology associations and physicians association also. I think after ये भी बंद हो गया. So, hello. So now couple of videos which will tell you why everything is important outside the clinic also. So run the video of that. How many of you have, been in a situation where somebody suddenly collapsed? ऐसा कुछ हुआ है किसी के साथ में? नहीं हो तो ये अच्छा है. All right. So this is a day-to-day activity. Some small group of people are doing a cricket match. No major psychological or physical stress happening here. This guy suddenly collapsed. Now, have you seen that now what generally happens? People get collected over there whenever somebody is in a such situation. And everybody tries to have a different opinion. But nobody knows what to do. People will tell you, we can stop the video now. Some people will also tell you that इस तरह वो तो नाटक कर रहा है. Somebody will tell you that अरे इसको झूठा संगाओ, अरे उसको एक झापड़ मारो. And everybody has their own ideas, but nobody is there to understand what has happened, and what happens कि वहाँ से एक ही काम हो सकता है. What will happen? We put them into some of the car or get the ambulance and ship to the hospital. And now we all know that time is very crucial. That initial 3 minutes of cardiac arrest is extremely important. If the brain doesn't get a blood in initial stage, whatever your attempts are going to be wasted, right? So 15-20 minutes, person reaching to the hospital, they do whatever the things that person, after some time they will declare that this person is now dead, right? So this is a common scenario. Another common scenario which our friend has described, in case of a situation where you are in a public gathering, say for example on the flight, and somebody, there is an announcement that is there a doctor in the flight. First of all, you don't like to go. You don't want to go because you are not yourself confident if I go there, whether I will be able to justice to that patient or not. So you try to hide and you just try to avoid that condition and you say that, yeah, chodo, I don't want to do it. And then you have a lot of excuses. अरे ये तो मेरा फील्ड नहीं है. अरे ये तो मेरे को थोड़ी आता है. वो तो एनेस्थेटिस्ट का काम है. मैं तो ऑर्थोपेडिक सर्जन है. Why should I go and treat this patient? No, first of all, we have to be agree that we are doctors and everybody around us who are non-medical are expecting you to do miracles. We know that we don't do miracles every day and we can't do miracles, but at least we can do certain learning which we have done, right? So our job is in this situation to go, analyze the situation and whatever you have learned, just deliver over there. This is what we are trying to learn today. See the another situation. So this gentleman in some office or somewhere, probably the bank. These are all original videos. And this gentleman suddenly died. So there are no, factors where you can judge that this person is going to die in next moment, right? Next. I guess which is working. Yeah. Again, a very happy environment. There is no stress. Somebody is performing a classical art on the stage. This was the pre-COVID and the date is also written. And this was anesthetist relative. Anesthetist was recording this. Now this guy collapsed over there. So these are the real life events. So what we wanted to emphasize here, that this kind of situation comes very often and it comes in a real life situation also. One more important thing you have to understand and give me one answer to that after learning today, every one of us will at least teach 10 people around us this CPR. This is what we wanted to emphasize. It is not for we 50 people learn and then we are going home and then we are masters of it. Everybody has to learn in a way that we are going to teach 10 more people, right? So far, where are the cardiac arrests been noted? We know that clinics and hospitals are common places because there are the patients. Patients come with the different medical conditions. But apart from clinics and hospitals, sports centers and gym, where the physical activities are at the extreme level. Marathon, again, a lot of people suddenly decides to do the marathon where 40-40 साल तक कुछ एक्सरसाइज नहीं किया और एक दिन डिसाइड करता है कि कल से अभी मैराथन का प्रैक्टिस करेगा. So then heart doesn't allow all these things suddenly. So without preconditions, if they start training themselves for an extreme sports, there is a possibility of such situations. Road trauma, fire, riots, trekking and camps at high altitude. These are the common places where we where we may face this kind of condition, people around us or maybe ourselves. So here one norm when we are learning this is that there has to be some motive. Now what is our most selfish motive in learning this? Is say for example, if I don't teach you all 100 people and something goes wrong to me, who is going to revive me? Right? So have a little selfish idea that I want to be survived. If I want to be revived and I want to survive, I have to teach 100 people around me. Same thing, that selfish idea for you. You are at home, your parents, your older parents or your friends or everybody or somebody is in a trouble, and if you are not able to do the effective CPR, you should have a selfish motive in this also. Just learn that learning is not only for our patients and only for our other people around in the citizen. It is for yourself and for your relatives also. So learn in a way that you should be able to teach to somebody else. And a couple of articles, these are early articles, which have said that CPR and defibrillation are the most effective manner for sudden cardiac arrest, which are across the globe, all the scientific data has proved. Unfortunately, India doesn't have any law where all the medical and paramedical people are compulsorily doing this course. Otherwise, if you see any developed country, they have a compulsion before their registration in the medical council gets renewed, right? So you have complete data about how CPR works and how CPR runs. Now let us start with the scene safety. First of all, we will be deciding about the scene safety outside the hospital. Wherever you find there is somebody is in a medical emergency, may not be CPR or maybe a CPR. Say for example, you saw somebody is in a trouble, somebody is unconscious, and you feel that this person needs medical help, and extreme medical help may go up to the CPR. First thing what we have to do is scene safety. We cannot start a CPR on the middle of the road if you find somebody on the middle of the road lying down and unresponsive, right? First thing is scene safety. So get that person out of that particular area, just have a look around. And there are incidences where people are doing CPR and some other car or somebody else is beating that person and both of them die. Say for example, riots happening. Say for example, people are fighting near you. Say for example, there are fire. Say for example, there is some building has collapsed. Or say for example, there is a major road accident. So just see that first and you are going out of the area where it is vulnerable. That place is not really correct for the CPR. Similarly, if you are near the water in some club where there is a slippery area, you can't start it. Just get out of that area. Say for example, in a building, or you are in the middle of the staircases where there are no proper surfaces where you can start CPR, or you are very near to the lift, right? In the house, say for example, somebody having a sudden cardiac arrest on the sofa. See that if that person doesn't fall, or you don't fall, or you both of you are safe. So first point to understand is scene safety, right? I probably teach you like in a student, just think that you don't know and you are trying to grab everything in again as a fresh candidate, fresh graduate. So don't feel bad that I am teaching like in a teacher and I am treating you like in a new case. But remember, in a case of an emergency, all this your learning process will give a lot of earnings in terms of your self-confidence. Because chaos situation, you will forget everything. Unless and until you learn everything like step by step. First thing to do is scene safety, right? एरोप्लेन में बोलते हैं ना सबसे पहला मास्क तुम लगाओ फिर बाजू वाले को लगाओ, right? Follow the same principle over here. Once you know that this person is in a trouble and you have decided that thing is safe. Now what you are going to do is ask that person whether he is responding or not. Now what are the most confusion point is here of it. For in between the person who is unconscious and the person who requires CPR. Just unconscious because of the certain reasons where heart and brain both are working, but the person who is just his heart is not working. This is the stage where you will understand. Number one, response. Now what are we looking for the response? Response in the sense we are trying to see the signs of life. Signs of life, how will you elicit? So, madam, can we demonstrate this? Sir, एक comment clear होना चाहिए. No matter.
पावर बैंक थी ना, किधर गई?
I will introduce my team. Shruti madam, Dr. Shruti. She is an anesthesiologist. Brilliant CPR player. Brilliant. Must have taught more than 10,000 people so far. And she runs an academy where they have various programs. We will discuss that academy related things at the end. But she has one more trainer, Dr. Pritesh Shah. He is also an anesthesiologist working on ambulance. And we have one radiologist, Madam Dr. Rupal. She is also brilliant radiologist and CPR trainer. Right? So we all are going to demonstrate small tricks. Please understand that tricks, right? So we are eliciting the response of a person who has just collapsed. So आपके सामने somebody is now collapsed. Now you have to ask for the response. So then as we written over there, ask and shout, are you okay? Right? So madam will demonstrate. Madam please.
So there is no danger to my life right now. So I'll move, stand stable so that if somebody pushes, I don't fall over the victim myself. Hello? Are you okay? Hello? Are you okay? There is no response. Okay?
Right. So what madam has done? Yeah. So what madam has done is only a tap on the shoulder and ask loudly. Right? These 2 points are extremely important. We are not touching the face. We are not touching the neck. We are not trying to move the neck because there is a possibility of cervical spine injury and you may worsen the condition. So by speaking loudly or tapping the shoulder, if somebody shows the signs of life, what are the signs of life? Blinking, moaning, moving the head, moving the hands, moving the body, you will see that something is happening. Say for example, कोई गहरी नींद में है, आप उसको उठाओगे तो कुछ तो करेगा ना? You will realize कि ये सोया है कि ये गया है. दोनों में से डिफरेंस तो मालूम पड़ेगा ना अपने को. Exactly same if you ask them कि whether it is response in a very gentle manner but loud and clear. If you know the name, there is no problem. Ask the name. But if you don't know the name, are you okay? ठीक हो भाई, क्या हुआ? You just ask couple of questions and try to elicit the response of a person. If he is not responding, we are heading towards the further steps of CPR probably. If he is not heading, then we will tell you what to do. In the CPR guidelines, first thing what we are going to do is a call for help. Now, why call for help is important at this junction. Before starting CPR, I will tell you and you will come to know in next 3-4 slides. You are alone. Say for example, you are doing CPR. How many minutes you are going to do CPR? Alone, right? Say for example, you will require a lot of equipment. You will require AED machines. You will require help for the aero management. You will require help for the drugs and everything. You will require help to shift this person to the hospital if you are not in the hospital. So call for help is an extremely important step. I would say that many people make mistakes over here. There are guidelines how you do call for help at the various places. In our hospital, say for example, such thing happens, we have a code blue. So we will just tell code blue, entire hospital knows there is one person and we will say that code blue and the second person tells code blue at second floor, ward, room number 202. So it is that precise. So same way in your clinic there has to be a helpline. Your clinic should know, everybody should know whom to call. Say for example, you collapsed and you have only one assistant who is there now. How do we that person decide whom to call? He will probably call the spouse of a dentist, and probably they are busy, equally busy, will not pick up the phone. Then what will do? So your clinic should have first of all an idea how to do call for help. Phone numbers clearly written, ambulance number clearly written, physician's number, anesthetist number, whomever you believe can come immediately and help should be written clearly and told everyone that if such thing happens, you are going to do 1, 2, 3, 4, 5, 6 numbers. I'll tell you how the call for help works. My building has got two doctors, me on the 3rd floor and one more physician on the 5th floor. One day I got at 12:30 or 45 that on 1st floor my mother is not responding. Now I was in a Kandivali and my house is in Malad. So immediately I realized that this physician always goes home between 12:30 to 1 for a lunch. I called him, where are you? He said, I am just building my every parking ke andar ja raha hu. I said, go to 1st floor, there is some emergency. He went there, he did CPR, shifted to the hospital next to our building. The lady is still alive. So what is the importance of call for help? Whom to call? Sometimes the person who can mobilize many things, calling him is also very important. Rather than calling a father, mother, brother, sister, those who are somewhere and they are not able to do anything. So every institute, every clinic, every hospital, every public gathering place, say for example here something goes wrong. किसको बुलाने का, किसको कहां से बुलाने का, किसको फोन करने का? Apart from the people inside, you need an immediately emergency services and ambulance and a doctors who can take care of this situation. One more thing, if you are outside the hospital when call for help goes, you have to specify how many people, which is the area, which type of the people. Say for example, Chincholi Bandar Road, Chincholi Bandar Road, next to the signal, Hanuman Mandir, 3 people were fighting, 2 are injured, 1 is not responding, probably needing a CPR. Your 2 children, 1 lady, 1 gentleman, you have to specify where is the place. You can't just say, jaldi aa jao, इधर आने का, जल्दी आ जाओ, इधर आने का, कितने लोग को लेके आओ, क्या लेके आओ मैं, और मुझे भी क्या लेके जाना है ना, if something like if call you call me, I have to decide what equipment I have to take. I can't take the entire hospital over there. I have to decide what kind of help is needed, right? So your call for help is an extremely important step. So everybody decide what is call for help. And one more thing, say for example, we all are working. Our old parents are at home. Say for example, one maid and our old mother is at home. Mother had something else. Now mother is in trouble. Now maid knows only 1 or 2 numbers. Maid doesn't have more numbers. They will call you. We give least important to our call from the house. We'll attend it later on after both come next. We don't attend that. Then the call goes to another member of the family. They will also not attend that. No, this is not acceptable. That maid should know how am I supposed to respond in this situation, or vice versa. 2 old parents are at home. One has something and one has something else. Right? Keep this in mind. That is call for help is extremely important. Organize yourself. Achha, how many of you knows that where is the AD machine in T2? Apna internationals? Correct. Airports, कहीं पे भी जा रहे हो, आप जिम में जा रहे हो. This is called as a situational awareness. You should be aware where you are traveling, what are the things around you. If you don't know that this thing is here, if you don't know where is the medical center in this particular place, where you are going regularly, say for example, Goregaon Sports Club, you are going every day. Where is the medical center? You should be knowing it. How many AEDs are there? Which places the AEDs are installed? Which ambulance they call? Where are the call? Where should I call if I have an emergency? Recently in Goregaon Sports Club, again one fellow had in the morning sweating and MI and chest pain, and then we had to shift him to the hospital. So these are the medical emergencies which we have to take care, and the first and most important thing, call for help. Organize your mind or your place to call for help. How to do the call for help, right? So you have taken that all the information, how you are going to call for them. And whenever we are in the, okay, so identify yourself, identify your location, number of victims, and if say for example, if you are in all this situation, if you are a victim, we are calling the person who has just happened, this is a victim, right? So if this victim is responding to you, responding is that he has shown the sign of life. साइन ऑफ लाइफ है, मतलब आपको सीपीआर अभी तो देने की जरूरत नहीं है, बट माइंड वेल मे रिक्वायर सीपीआर एट एनी टाइम, बिकॉज अभी ब्रेक चालू है, अभी हार्ट चालू है, अभी ब्रीदिंग चालू है, बट दैट कैन गो suddenly stop and then you may require CPR. So we have to vigilantly observe him, observation just in a recovery position. The position I will tell you, it is just a lateral position on the one side lateral position में उनको रखो and then keep observing and wait for the medical people to come with their better equipments so we can transfer them. Till the time you are going to observe. Because after 5 minutes, say for example, again, not breathing, not responding, no pulse or no cardiac symptoms, then you are going to start CPR, right? So for all the CPR, the first and foremost important thing is a firm and flat surface, because the way we press from above, there has to be a proper surface where our efforts of pressing the chest will be delivered to the heart. If समझो सोफा पे कुछ कर रहे हैं, तो जैसे ही आप ऊपर से प्रेस करोगे पूरा बॉडी नीचे जाएगा और इफेक्टिव सीपीआर होगा नहीं. तो firm and first surface is extremely important. Whenever we have, now we decided the scene safety हो गया. Now we have try to check the response, but we're not responding, right? So now next step is we have to find out whether, and you have called the ambulance also, you have called the people around also. Next step is to find out the respiration and the pulse both. Now for the medical people, what we are advocating is do check the breathing and the pulse both, right? Breathing and pulse both at a time. When you are trying to check the respiration, check the pulse also. Pulse we are checking on the carotid, we never check the radial, because whenever there is a cardiac arrest kind of situation and the BP is less than 60-70, you will not find radial, you will only find a carotid, right? So carotid and breathing both we have to check together, but first how we are going to check the breathing. So you are next to the person, victim, right? Right.
So ideally you count for 10 seconds, because you can't waste time here in this case. So you count 10 seconds, so you're not actually wasting time, because it's a panic situation. We don't know how long 10 seconds are going to be. So ideally you count 10 seconds and observe, look at the chest and not the abdomen. Okay, look at कुत्ते को कभी देखा सांस लेते हुए? So it is a regular movement, right? So that is what you're going to observe at the chest for 10 seconds. So I'm going to be counting for 10 seconds. I'll just give a small head tilt, okay? And then feel for the breaths on my cheek, listen to the breathing, and at the same time look at the chest and observe breathing, okay? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So if the person is breathing, you'll be able to pick up at least 2 or 3 breaths in 10 seconds.
Right. So now I tell you we will combine my recent experience. Now that day, my friend was was behind me when he was doing some exercise. So he tried to do something like squatting. So he fell down. Now I am here. My face is on that side. So when I turn on him, he was lying on the floor. So now I went and saw my own CCTV footage next day. What I have done. So now I am observing him from the outside and trying to judge कि ये योगा कर रहा है, कि सो गया है, कि गया है. Because it is not that easy unless and until you are trained. So now our eyes are trained, right? I have seen in that CCTV footage 5 more people around me walk by him. एक बंदा इधर एक्सरसाइज कर रहा था, उसको देख के वो ऐसा उठ के ऐसे चला गया. दूसरा इधर से आया, उधर एक्सरसाइज चालू की. तीसरा उधर से आया, ऐसे चला गया. चौथा अभी भी लगा हुआ है अपने काम में. उसको देख रहे हैं सब लोग, ऐसा गिरा हुआ है. तो ये जो रियलाइजेशन है ना, वो अपने अगर ट्रेन है ना तो वो आ जाता है. So that within that couple of seconds I realize he's not blinking. No, he's not doing savasana, he's not breathing also. So why I am telling you this is very important. ये सिचुएशन जब आती है ना तो अपने को लगता है कि आसान है, but identification are not that easy unless and until you keep this in your mind a couple of times. So our eyes goes by default on the abdomen that no, he's not breathing. अरे वो chest भी move नहीं हो रहा है, ये भी move नहीं हो रहा है, not blinking also. And then you realize कि अरे color भी blue हो रहा है. So ये जो चीजें हैं वो आएगी जब आप breathing को एक बार ध्यान से आप दिमाग में डालोगे, ये normal breathing होती है. Sometimes in some situations it becomes an abnormal breathing also, but breathing is there. You realize whether breathing is there or not. Here the point is whether you are able to identify person is breathing or not breathing. If he is not breathing, we are going to the next step. If he is breathing, then also we have another options. Now, how many of you knows how to do carotid checking? Right? Great. We all should be knowing. Let us start again. सब लोग अपना अपना carotid check करो. Put your hand on the center. ये अपना adult circle and then go on the lateral side. 3 fingers को हमेशा use करो. Don't use only 1 finger because it will be difficult in a low volume hypotensive patient to identify. 3 fingers, say for example on a vertical manner, side में लो. कितने को मिल रहा है carotid? जिसको नहीं मिल रहा है वो आगे आ जाओ. स्टार्ट सीपीआर. श्योर ना? मिला ना सबको? मिला ना? उस समय पे मिलना चाहिए. प्रॉब्लम ये है कि अभी मैं अगेन लाइव स्टोरी बता रहा हूँ. I could not find carotid, but I was very disturbed while checking the carotid also because ये मेरा दोस्त है. इसको ये हुआ है तो you are in a psychological trauma. There are 20 people who are gathered and everybody is giving some suggestions. And you are the only person who knows and you are trying to find out. अरे ये तो मेरे को करने का तुम लोग शांति रखो. But तुम वो भी बोलने को टाइम नहीं है. तुम्हारे पास कुछ भी बोलने को टाइम नहीं है. तो खाली कैरोटिड पे हाथ रखना है. अपने को जो नॉलेज है उसको हाथ रखना है. 10 सेकंड में समझा तो समझा, नहीं समझा तो कैरोटिड नहीं है. If you can't find in 10 seconds, consider there is no carotid pulse. Means there is a cardiac arrest. Right? Breathing भी 10 seconds में आपको समझ में आ रहा है तो समझिए. One more point which I forgot to tell. You may require to remove certain clothes to see the breathing. और हाथ भी रखना पड़ता है कभी. Because shallow breathing will not be identified, especially in a winter where a lot of people having 2-3 more clothes, right? दोनों साथ में, पल्स दोनों साथ में.
So ideally we do pulse and breathing checking goes together. And when we're doing the carotid check, it's ideally you push it against the thyroid cartilage. When you're looking at the radial, you're actually looking at it against the radial bone. So whenever we check for pulse, it's against a bone. यहाँ पे bone नहीं है, so what we do is you push it against the thyroid and check. This will push it away from the thyroid. So ideally, it's better you'll be able to palpate it better on somebody else. So what I'll do is I'll have to open the, like sir said, I'll have to remove certain clothes. So I'll remove the collar here, and I'll move from the trachea towards myself. Whichever side. If I'm sitting on that side, I put my finger that side. There's a small, there's a groove here, just below the, just beside the carotid. गड्ढे जैसा है. That's where you'll find the carotid. You'll have to push the carotid against the thyroid to feel it, because like sir was saying, low volume pulse, you might not be able to pick it up. So what I do is, I'm going to palpate, tilt the head and count. Look at the chest. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I couldn't feel a pulse and there is no breathing. Is that okay?
Both the things are done together to save time again, right? What is our goal? Early recognition, early CPR and early reward. Early word is used. Do not delay your CPR. Now, if you just waste 3-4 minutes in finding out carotid है कि नहीं, breathing है कि नहीं, ठीक है कि नहीं, चल रहा है कि नहीं, the most precious time is gone, right? So you have to do everything in a 10 seconds. So find your hand on the carotid, your eyes on the abdomen, whether rising or not. Your cheek is trying to feel the breathing, and your ears, if there is no loud music around, you are trying to hear the sounds of the breathing. All these things together will decide whether this person requires CPR or not. So here, what are the do's and don'ts? So don't wait more than 10 seconds to palpate carotid. Don't change position to palpate the carotid. मतलब person को ऐसा lateral करो, सीधा करो, उल्टा करो, कुछ मत करो. Don't palpate carotid on both the side together. Don't use both the hands. दोनों हाथ में लगा दिया, क्या होगा? दोनों लगाएंगे तो
You're stopping the blood.
You are stopping the blood flow to the brain from the, because you are pressing both the carotids together, right? So you are worsening the condition. Only एक ही side का carotid को अपने को push करना है. Don't forget to look for the chest rise and abdomen, and don't delay in performing the CPR. Entire goal is don't delay CPR, don't delay CPR, don't delay CPR. Right? Now, key message is palpate the carotid pulse in scan for breathing within 10 seconds. Absence of breathing and carotid indicates cardiac arrest. And if you can't palpate carotid within 10 seconds, consider it is absent and avoid delay initiating high voltage CPR. ये सब लोग दिमाग में लगा लो, मैं क्वेश्चन पूछूंगा, ये ऑलरेडी क्वेश्चंस मैंने दे दिए, इसके आंसर देने आपको. Those who are sleeping will not go till the dinner. Please be sure that I am going to ask you the questions. Now, there are dilemmas always. There are always dilemmas. So, once in my training session, one doctor said, junior doctor said that, I had similar situation, but I was not sure. CPR करना है नहीं. I could not identify. तो मैंने कुछ नहीं किया, मैंने उनको बोला कि शिफ्ट करो हॉस्पिटल. So one other fellow said that कि अरे बॉस अपन ऐसे सिचुएशन में ना ये सब नहीं कर सकते, वो क्या कौन इतना जिम्मेदारी लेगा, उसको शिफ्ट कर देने का हॉस्पिटल में. I said if this is the approach of a doctor per se, then how can we teach a non-medical people? Non-medical people doesn't want to take any responsibility in any situation. But he said that the old one old orthopedic surgeon said कि हमारे टाइम पे ऐसा होता था कि रिलेटिव्स ऐसे बात करते, रिलेटिव्स के परसेप्शन जैसे हम लोग डिस्कस कर रहे हैं, रिलेटिव का परसेप्शन एकदम अलग है. रिलेटिव्स क्या बोलते हैं मालूम है, अरे हमारे उधर तो डेथ हो गई, उधर लोगों ने तो बोला आपने बहुत मेहनत किया, लेकिन मैंने देखा डॉक्टर ने छाती दबा दबा के मार डाला. बोले हमारे जमाने में तो ऐसा थिंकिंग प्रोसेस है पेशेंट का कि छाती दबा दबा के मार डाला. अभी if there are such kind of thinking process, we have to overcome this all mentality and ourselves will have to grow much beyond that. Number one, by doing a CPR, we are not going to harm anyone unless and until you do gross mistakes. You are going to help somebody. Number two, if you don't understand CPR चाहिए कि नहीं, करूँ कि नहीं. Say for example, I say कि कैरोटिड 10 सेकंड में नहीं मिल रहा है तो कंसीडर नहीं है, ब्रीदिंग नहीं समझ रहा है कंसीडर नहीं है. तो एक बंदे ने पूछा अगर उसको जरूरत नहीं है और मैंने सीपीआर चालू किया तो क्या होगा? कुछ नहीं होगा, उठ के मारेगा. वो उठ के मारेगा तो अच्छा है ना, जिंदा है ना. So why this question has come from the doctor fraternity कि भाई नहीं चाहिए उसको, तूने कर दिया, अच्छा है ना. वो see that CPR per se is a very strong stimulus. If we आप लोगों ने एनेस्थेसिस को देखा होगा, खत्म होने के बाद जोर से चिमटा विमटा काटते हैं पेशेंट को उठाने के लिए. We are trying to give a painful stimulus to awake the patient. So अगर वो हो गया सिचुएशन में, आपने जैसे ही पहला उसके अंदर रखोगे, इट्स a very strong stimulus. हाँ, अगर उसका कुछ चेस्ट में इंजरी है और कुछ लफड़ा है तो then you are going to worsen the condition. But I guess all the doctors are sensible enough to understand that you are not going to grossly do all this problem. But in case of the very situations where you don't really identify whether CPR is needed or not, better to go towards the CPR rather than not doing the CPR. Now, normal breathing with definite carotid pulse. Normal breathing with definite carotid. Person is, well, you have seen that clinical scenario. Person is collapsed, but there is a normal breathing with definite pulse. तो अभी breathing भी है और pulse भी है, तो क्या करना है? कुछ नहीं करना है, नहीं करेंगे ना? शिफ्ट करेंगे. शिफ्ट करने के पहले हम उसको रिकवरी पोजीशन में रखेंगे, ऑब्जर्व करेंगे, जब तक कोई आएगा शिफ्ट करेंगे. या तो अगर अपने रिलेटिव है, मुझे ही लेके जाना है, तो देन वी विल प्रोबेबली ट्राई टू शिफ्ट द एज अर्ली एज पॉसिबल. अगर एबनॉर्मल और नो ब्रीदिंग विद द डेफिनेट कैरोटिड पल्स, एबनॉर्मल और नो ब्रीदिंग. एबनॉर्मल ब्रीदिंग मतलब सम टाइम यू ऑल एवरीबॉडी मस्ट हैव द गास्पिंग ब्रीदिंग. ऐसा एकदम यू फील दैट कि अभी ये जाने वाला है, मतलब इट इज प्रोबेबली वी आर गोइंग टुवर्ड्स द CPR, बट देयर इज a still some time before that, right? So these are the respiratory distress patients. Respiratory distress patient, if you put in a pulse oximeter, they have a SpO2 of 75, 80 or something like that. So provide 1 or 2 breaths for every 5 seconds, reassess every 2 minutes, right? You have to provide a breathing this situation, only breathing. You will not require, because there is a definite carotid pulse, right? But then abnormal or no breathing without definite carotid pulse absent. अगर एक without any definite carotid pulse or a pulse is not there, the moment there is no pulse, when the moment you feel there is no carotid, right? So you are going to start a CPR. नो ये यहाँ तक का अगर क्लियरिटी आ रहा है तो अपन आगे जाए। क्लियरिटी आ रहा है? नहीं और बिंदास बोलो नहीं आ रहा है तो
Sir, recovery position means on the lateral side.
लेटरल साइड वो मैं आप सब पिक्चर में दिखा रहा हूँ। रिकवरी पोजीशन इज ऑन द लेफ्ट, पुटिंग ऑन द लेटरल साइड। यहाँ तक का क्लियरिटी आ रहा है क्या?
अगर दिख रहा है कि चेस्ट इंजरी हो सकता है तो बिल्कुल कुछ करना है कि
चेस्ट इंजरी हो सकता है तो उसका मैं आपको आगे बता दूंगा। वो बहुत रेयर सिनेरियो है। पहले आप नॉर्मल सिनेरियोस ले लो, आपको नॉर्मल सिनेरियोस पहले आ जाता है, फिर अपन एब्नॉर्मल सिनेरियोस पे जाएंगे।
नॉर्मली गुड समारिटन इन डेथ जो बोलते हैं उसको ये आराम से हम काउंटर कर सकते हैं, जैसे रीअसेस करके। तो उसको मतलब कितनी बार वो रिस्पॉन्स नहीं करते हैं इन टर्म्स ऑफ वॉइस रिस्पॉन्स, ब्रीदिंग रहता है, कैरोटिड रहता है,
ब्रीदिंग कैरोटिड में कुछ नहीं करना है। ब्रीदिंग कैरोटिड में कुछ नहीं, रिकवरी पोजीशन में लो, वेट करो, somebody will come and shift unless and until you have advanced equipment. Say for example this happens in a hospital, so we have our, हम लोग तो आईवी डालेंगे, हम लोग ईसीजी लगाएंगे, हम लोग शुगर करेंगे, हम लोग बहुत सारी चीजें करेंगे वहां पे। बट ये we are talking about this is happening in the clinic, or this is happening where you have a minimal equipment, you are doing a basic cardiac life support, then everything else comes in an advanced cardiac life support. So अगर आपको पल्स ये सिंपल, ये सिंप्लीफाइड है, एकदम सिंप्लीफाइड है, नॉर्मल ब्रीथिंग विद डेफिनेट कैरोटिड पल्स या एब्नॉर्मल और ए नो ब्रीथिंग विद डेफिनेट कैरोटिड पल्स। अगर ब्रीथिंग में थोड़ा प्रॉब्लम है तो आप ब्रीथ दे रहे हो, बट सीपीआर की जरूरत नहीं पड़ रही है। बट द मोमेंट यू हैव नो कैरोटिड, द मोमेंट यू हैव नो कैरोटिड, द मोमेंट यू आर नॉट फाइंडिंग एनी कैरोटिड, यू आर गोइंग टू स्टार्ट दिस, राइट? सबसे इंपॉर्टेंट चीज आ जाती है अगेन, हाउ यू हैव एलिसिटेड रिस्पॉन्स and how you have started calling for the help, because अभी यहाँ पे आप वेट कर रहे हो, कोई आ नहीं रहा है आधे पौने घंटे तक, तो आपका अभी सीपीआर वाला सिचुएशन आने वाला है अगर उसको मेडिकल हेल्प आप नहीं दे पा रहे हैं तो, राइट?
How long can this lateral position पे हम लोग कितने
टिल द टाइम आप पेशेंट को शिफ्ट नहीं कर सकते हो, या टिल द टाइम somebody comes and takes over from somebody expert than you, somebody who is more expert than you। अगर आपका बाजू वाले आके बैठेंगे तो कोई फायदा नहीं है। आजू बाजू वाले आके बैठे, तीन चार लोग आगे बैठ जाते हो, नहीं वो तुम मत जाओ, ये सीपीआर होने वाला है इसका, अभी तुम जाओगे तो कौन करेगा? अपने पास कोई बंदा ऐसा आ जाए वो आपसे एक्सपर्ट है, या आप उसको हॉस्पिटल में गाड़ी में डाल के लेके जाओ, या तो एम्बुलेंस वाला आया नाउ दे आर ट्रेन फॉर इमरजेंसी मेडिसिन, फिर आप छोड़ दो उसको, तब तक तो आपको देखना ही है। क्लियरिटी भाई बोलो।
So what if there is no lateral ground present? What if it's a staircase or something where?
जो अब स्टेयरकेस वगैरह है तो आप कोई भी दो स्टेयरकेस के बीच में जो जगह रहती है वहां पे ले लो, बट वहां पे पहले ऐसे स्टेयरकेस के ऊपर मत शुरू करो ऐसा। अब ये गिर रहा है तो गिरते गिरते इतना एक्सपर्ट मत बन जाओ, गिरते गिरते इसी जगह आ जाए, तो उतना एक्सपर्ट नहीं बन सकता ना, तो उसको नीचे ले लो ना। मतलब अभी तो सिखाया है ना, आज ही सिखाया है, तो अभी तो गिरते गिरते भी हाथ नहीं छोड़ेगा, उसका चालू हाथ में चालू करके रहोगे, नीचे तो आने दो उसको, ऊपर से नीचे से तो आने।
बस CPR हो जाएगा सर।
चालू करें, आगे आगे जाए, चलेगा ना? हाँ, यहाँ तक पास हो जाएंगे तो। नाउ चेस्ट कंप्रेशन के पहले दो चार चीजें अपने को इम्पोर्टेंट है। नाउ मैडम विल डेमोंस्ट्रेट एवरीथिंग। सो चार पांच चीजों का नाम है, जैसे एक सावित्री आसन बोलते हैं। सावित्री आसन इज द एक्चुअल पोजीशन बाय विच यू स्टैंड नेक्स्ट टू द पेशेंट। सबसे पहला जो मैंने बताया वैसा रूल है सीपीआर चालू करने के पहले, फॉर्म एंड फ्लैट सरफेस। जब तक सरफेस फ्लैट और हार्ड नहीं है तब तक आपके एफर्ट्स बराबर से नहीं जाने वाले, राइट? सो वी विल जस्ट मैडम एक काम करें आप, हैंड्स की पोजीशन एंड ऑल। सो वी विल जस्ट सी दैट फर्स्ट। आप चल, हाँ, आपको माइक होल्ड करना है,
नहीं,
हैंड पोजीशन। So let us see how the hands position.
So hand position is typically called as elbows straight and locked. What do you mean by elbow straight and locked? So you keep your hands straight out. Use the other hand. Everybody is able to hear me in the end. आखिर तक सुनाई देगी आवाज? नहीं, you can. They're able to hear. You're able to hear me, right?
Yes.
Okay. So elbow straight out. Okay. Use the other hand to pull your fingers back.
Everybody do that. Everybody learn.
Yeah.
So everybody do.
So why are we doing this? We want to make the heel of the palm prominent. Okay? We are not using our fingers to give the compression. We use the heel of the palm to give the compression. Okay? Now elbows are straight and locked. What do I mean by locked? When I do this, my elbows are facing, the cubital fossa is facing inside, right? I pull, bring it out. I literally rotate my hand and bring it out. अभी हाथ bend करने की कोशिश करो. Bend the elbow. Exactly. So this is what we want. Your shoulder, elbow and wrist has to be in a straight line. आपने कैस्ट्रॉल वाला ad देखा होगा, piston वाला. So your shoulder, elbow and wrist acts like a piston. Movement will be at the hip joint. Okay. Where will I place my hand? Where will I place my hand? Sternum. Which part of the sternum? Not at the zippy sternum. Okay, just above the zippy sternum. How do I know that? Zippy sternum is the last tip. If you trace your sternum down to the tip is the zippy sternum. So the point where the rib cage meets, you leave 2 finger space and then place your heel at the center. Okay. A better medical point is draw an imaginary line between 2 nipples. The midpoint of that line will be the center. Is that okay?
एक काम करते हैं, सब लोग अपना अपना सेंटर ऑफ द चेस्ट डिसाइड करो. चलो स्टार्ट फ्रॉम द दिस द स्टर्नल नॉच से शुरू करो. नीचे जाओ, फील द बोन, गो डाउन. एक मोमेंट में वो बोन खत्म हो रहा है एंड एब्डोमेन शुरू हो रहा है. द सॉफ्ट पार्ट स्टार्ट्स, राइट. उसके 2 फिंगर्स जो नीचे खत्म हुआ, उसके 2 फिंगर के ऊपर, that is the part where you are going to put your heel of your hand. Heel of the hand is going to be at that particular. बराबर? किसी के मन में
go back in the stand and see. So this is how I'm going to be placing my hand. Okay? This is how. My fingers are going to go on the chest actually. Okay?
All those who cannot, please.
right?
Maybe remove your shoes and stand up. Remove your shoes and stand up on the chairs.
नहीं काम कर रहा
Please come.
मैडम आई विल होल्ड
Sorry.
मैडम आई विल होल्ड दिस थिंग. चलो आप ऊपर आइए. हम लोग होल्ड. So what madam has said, अपना जो बोन है, जो सुप्रास्टर्नल नॉच, स्टर्नम के ऊपर का नॉच है, उसको ट्रेस करो. नीचे आ जाओ. ये बोन यहाँ पे खत्म हो रहा है और टमी शुरू हो रहा है, राइट. सॉफ्ट पार्ट स्टार्टेड, हार्ड पार्ट इज ऑफ. उसको 2 फिंगर्स ऊपर यहाँ पे अगर अपने को हाथ रखना है, हाथ को ऐसा नहीं रखना है, हाथ को ऐसा रखना है, राइट. ये जनरली 2 निप्पल के बीच में आता है. अपना हार्ट लेफ्ट साइड में है, तो हमको क्यों लेफ्ट साइड पे नहीं कर रहे? वाई आर वी नॉट प्रेसिंग ऑन द लेफ्ट साइड? हार्ट तो लेफ्ट में, तो ऊपर ही दबाओ ना यार. सेंटर में क्यों जा रहे हैं हम? रिब केज फ्रैक्चर होएगा तो क्या होएगा? तो न्यूमोथोरेक्स होएगा. Another thing, rib is a very strong structure. Strongest bone is a sternum. हमको पूरा चेस्ट को कंप्रेस करके उसके नीचे जो हार्ट है उसको कंप्रेस करना है. So we are not putting a pressure on the left side. We are putting a pressure on the center, and we are trying to stay on the center during the entire process of CPR. Because अगर हाथ थोड़ा भी स्लिप हुआ तो लेटरल में जाएगा और रिब और स्टर्नम के बीच का जो जॉइंट होता है, राइट, स्टर्नोक्लेविकुलर जॉइंट, वो फ्रैक्चर होएगा. एंड देयर कैन बी ए pneumothorax, pneumothorax, or a direct trauma to the heart is possible, right? So we are not going on the left side. We are going to be in the center of the chest, center of the. ये पूरे CPR का सबसे important point, finding the center of the chest. सबसे important point, because you may put on the left, you may put on the right. This thing only going to decrease the efficiency of a CPR. We want a good, effective CPR, right? So center of the chest, hand is in this position and another hand is locked. Everybody got this idea, right? हाँ बताओ.
So basically आप लोगों ने बोला heart left side में है ना?
हाँ टेबल.
You all said heart is at the left side. How many of you believe heart is at the left side?
Apex left side.
Apex is on the left side.
Heart is at the left side. Almost in the center. Mediastinum. Where is the mediastinum?
Between the lungs.
So why do we believe left side में heart?
Apex is tended towards.
शाहरुख खान को प्यार left side में होगा. We're all media educated people. So heart is in the center, tilted to the left. Okay? It is centrostellar structure.
2 minutes. Yes, the question is whether which hand to be below and which hand to be up. So whatever the dominant hand, आपका जो भी dominant hand है, वो नीचे जाएगा, उसको सपोर्ट करने के लिए आएगा. हाथ को आप ऐसा पकड़ो या ऐसा पकड़ो. That's all up to you. There is no problem in that placing the hand. You place it like this or you place it like this. आपको ये हाथ नीचे चाहिए कि ये हाथ नीचे चाहिए. That is up to you. But it has to be kept one above the other, lock it properly, and it has to be on the center of the chest. Right? Patient की कोई भी साइड चलेगी, राइट या लेफ्ट साइड चलेगी, हिडन पे नहीं चलेगा, लेगेट पे नहीं चलेगा. राइट? हिडन पे आप पहुंचोगे, लेकिन नॉट डिफेक्टिव, लेगेट से आप पहुंचोगे. लेगेट से मतलब मैं यहाँ से तो सीपीआर नहीं कर सकता हूँ, वहां से भी सीपीआर नहीं कर सकता हूँ, बट यहाँ पे भी रह सकता हूँ, यहाँ पे भी रह सकता हूँ. राइट या लेफ्ट, whichever the position, whichever the place is comfortable.
The finger direction doesn't matter, but the heel on the sternum that matters.
That is most important, most important. Then everything else matters when it comes to the finer point of CPR. But the first important thing is identifying the center of the chest and putting the hand in the right place. Right? This is extreme. दूसरा हाथ अगर लॉक नहीं करोगे, say for example if you don't lock the hand, then what? Madam, just lock without locking. It just will after some time it will slide on one of the side, और ये उड़ जाएगा. See what is people have.
और या फिर आटा मलेंगे सब लोग, ये वाला मूवमेंट आएगा. ये वाला मूवमेंट नहीं चाहिए अपने को. We want a straight movement where your body is moving up and down. This remains straight. So locking your fingers, make sure only the heel is transmitting the pressure. So this is C. And if I don't, what I'm doing is if I pull the fingers back, my heel becomes prominent. Okay? So this I can do. Okay? And then one. ये ऐसे करने की कोशिश हो जाएगी. If I don't do that, I try to push with my wrist, and I am at the risk of hurting myself. Okay, injuring myself.
So one more point why we are doing so much, that you should not get backache or you should not get tired early. So say for example you are alone and you are going to do this CPR for 15 minutes alone. If you don't do it properly, you will be tired and your back will start hurting, and then you will leave that these efforts, and then that person will be in trouble. So having a right position is extremely important. And now if the person is on the floor, so the way madam is standing next to the patient and putting the hand on the chest, and now see the force, where the force is coming, right?
If your position is correct, your nose will be outside the patient's line. If your nose is on top of the patient, that means you're still leaning back. You'll probably use your shoulder, especially people who go to the gyms. The natural inclination is to use your shoulder to give the pressure. Please don't do that. Please be using your body weight. Okay? So what I do is I'm going to do 5 centimeters or 2 inches down, come out completely. I'm not going to do this. Okay? I'll be going in, come out. Go in, come out. And this is done at the rate of 100 to 120 compressions per minute, which is लगभग 2 compressions in 1 second. Right? 2, 3, 4, 5, 6, 7. See, I'm not doing this. I'm not doing this. And I'm not trying to push with my shoulders. My shoulder, elbow and wrist are in the straight line. I've locked my elbows and movement is 1, 2, 3. Count with me. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30, 1, 2, 3, 4. क्योंकि अगर मैं ये 100, 150, 100 to 120 per minute अगर करना है, तो what will happen? I'll start counting 101, 102, 103, right? So and plus after 30 compressions, we generally have to give a breath whenever possible, which we're not covering today. But 30 के count में 1 to 30, 1 to 30, 1 to 30, you start going continuously. And if you don't count when you're doing it on the mannequin, you will not get the rhythm. Okay? So we always count.
So what madam has said, 1 minute, how many counts?
30.
भाई डिनर का तैयारी करो, डिनर का तैयारी करो, नहीं जाने वाला कोई. 1 minute में 100 to 120 times, right? And how much depth?
5 centimeters.
5 centimeter. अगर somebody asks me कि how do you understand 5 centimeter? 5 centimeter कितना होता है? So ये जो अंगूठा है अपना 2 to 2.5 inches, this is the depth where how much you are going to do, this much you are going to do. Now another question is, somebody is 40 kg, somebody is 180 kg. So here this is your perception of how much depth you are able to give. This much depth for anybody is required, 2 to 2.5, which is a now internationally acclaimed and understood that कि अगर इतना नीचे नहीं जाएगा तो heart press नहीं होने वाला. You understood my point?
So if you look at the mannequin, it should go down at least 5 centimeters इतना. Okay, इतना अंदर जाना ही है.
One more important point, what madam is saying, press and come out. What is that? That is recoil. So what exactly we are doing while we are doing a CPR? What exactly we are doing? 2.5 depth हो गया.
During CPR, what is certainly controlled by two mechanisms. The cardiac
Just have a look at it.
thoracic pump mechanism. The cardiac pump mechanism directs compression of the heart through the sternum of the spine forces of the heart. But more importantly, the chest also becomes a thoracic pump. Chest compressions create a positive pressure, forces the blood to the heart and air from the lungs. Compressions also cause a slight increase in intracranial pressure, reduces cerebral perfusion. Then, during the decompression phase,
Now this is recoil. This is exactly what madam is saying.
a slight negative intrathoracic
Right.
pressure.
Now you understand this point very clearly, everybody.
The heart
Focus on this point.
air into the lungs and loose the coronary arteries. ICP is also slightly lowered during decompression.
So now this point is extremely important. Why we are doing it again?
CPR alone does not maximize.
Right. Now what we are trying to understand? Compress the heart. Release also. Release is also equally important. Not only compression. I have seen couple of people doing CPR on initial stage. They do CPR like this. Then they do when business अरे बहुत emergency एकदम जोश में आ गए. जोश में आ गए. This is not the correct way of doing CPR. They have so much of enthusiasm that they push everything out, but then nothing is in the heart. So you have to have recoil. Recoil means you push it, then let it come out because blood पूरा गया. So blood को वापस तो आना है. Before you next time you push it, the blood has to come back. This is an extremely important point. So 100 to 120 per minute, 2.5 inches or a 5 centimeter depth. Complete recoil during the every compression, right? If we are not able to do this, then effective CPR is not there. So what is important for doctors or paramedics to understand not only CPR, effective CPR. Effective CPR is when you are doing all these 5 points absolutely perfect. And when you are able to do perfect, you will be able to continue this for 15 minutes. We do in our ICU for 45 minutes. 3-4 लोग मिलके 45 minutes से CPR चल रहा है. You try and give me 5 minutes. 5 मिनट में आपका CPR का quality down होना शुरू हो जाता है unless and until you have positioned yourself very well. So this point is clear. CPR point is very clear. And position, center of the chest, number of counts, depth. Everybody is clear?
Yes, sir.
In OT where it is at a table height, and if you wish to do a CPR, तो आप उसको take it on the ground or
No, we create something on the stool,
There's always a
table
stool.
or something.
There is two.
And our ICU, all our ICU beds are CPR compliant. Means 3 लोग भी अगर ऊपर चढ़ के CPR कर रहे हैं 120 किलो का पेशेंट तो भी बेड नीचे नहीं जाएगा. They are very firm and very sturdy beds. Actually, that's why the beds are different. And some beds are now CPR beds also comes. So there is a properly formed surface on that particular area where we require that critically ill patient sometime. Right? Any more problems now? Up till now?
So is it important if you are on the side of the patient or facing the patient? There's movies में दिखाते हैं ना the patient के सामने the bed के बाजू है. So does it matter if you're doing it from the side?
So it can be done only on the side. It can be only on the side. You cannot do it from here. I can't give CPR like this. I can only give CPR from here or I can give it from here. I cannot do it like standing here and doing CPR. वो फोटोग्राफी के लिए बराबर है पर अपने को तो ऐसे ही करना है. अपना कोई फोटो नहीं खींचने वाला है.
You thaliva मुझे नहीं. No thaliva here.
Right. So now the next topic. Once we are
I have a question. If it's a woman, and how do we exactly determine where to place the heel of the hand? Because a lot of times, if we're in a public setting, we won't be able to.
It would be, so that's why there is one more method. If you are not able to understand anything, you have to identify the umbilicus. This is the last method you have to identify. And identify the umbilicus, which is very easy to identify, right? Then you go up. And when the bone starts. So either you come from above to below or you come below to up. This is more easy, that's why we teach this. And once you can at least feel the bone, na? It is very easy. How many clothes are there? So once you see that, once the bone is done and there is a soft part started, then 2 fingers above, you have to put in your hand. It has to be feeling that hard surface. That is a Zifi sternum. We have to, that's a sternum. We have to identify the sternum bone. So अगर umbilicus से आप ऊपर गए, say for example, and you identify there is a bone, go 2 fingers up and then again put it.
So you'll be able to feel the sternum irrespective of whether it's a man or a woman. Because that's the most superficial bone, one, like Saurabh already has said. Second thing is, your probably question is about exposing the woman and the exposure part. Probably that's what you're asking. So Abadi India ki China se bhi zyada hai, right? So make use of that resource that we have. What we generally teach in first aid, especially outside hospital first aid, is you have people stand surrounding back to back. Create a private space. And why only women? Men also, once you expose, find the place, cover them up. Why only women? No partiality. Even men, you cover them up later. Okay?
Right? We'll go ahead with the airway now. Right? So up till now we have decided about the compression. Right? So we are right now we are busy with the circulation. Now we are moving towards the airway. Right? So if there are no possibility of doing an airway like ambu bag or a something hi-fi or an equipment based, what you can do is a head lift and chin lift. In that case, that particular day in a gym, for that particular doctor, I had no equipment except AD. So my gym instructor, lady gym instructor was very enthusiastic. I told her just to lift the chin and given one task to her that you are going to do this only, nothing else. Right? So just put just a chin lift or head tilt is the more than important part. As we saw in that video, once you do the chest compression, the entire thoracic cage moves. So whatever the air in the lungs goes out, and when you release, the atmospheric oxygen also goes inside. But what is more important? By doing this, we are opening the passage of airway. Majority time when somebody collapses immediately, all the muscles get relaxed, and they are in generally this position. They are generally, whatever the situation, their neck falls in one direction, and because of that, tongue and pharynx are together, and there is no space. By doing this, you are giving some space between the tongue and the pharynx to oxygen to keep moving out and in. Got the idea?
Yes.
Got the idea? Right. So, one person and one more thing, when we have equipment or when we have something more than this, then I'll just show this. Head lift and chin lift, and how many of you know how to do this jaw thrust maneuver? I mean, have you ever tried with your anesthetist? हम लोग को ऐसा नहीं ऐसा पकड़ के खड़े रहते हैं at the end of the procedure. माउथ में सर्जरी किया है, पेशेंट को एक्सट्यूबेट करते हैं, तो ऐसे लोग पकड़ के रहते हैं. कभी-कभी 2 हाथ यूज करते हैं, कभी 1 हाथ यूज करते हैं. You guys are expert into this. You just have to see it once. ये जो अपना TM joint mandible है ना, उसको थोड़ा सा आगे करके ऊपर ले.
Lock jaw.
बस ऐसा करके थोड़ा आगे.
Lock jaw.
Yes. So
Can you
once.
see this here?
Yeah, we just see what madam is doing.
Angle of the mandible, you just push it anteriorly. That's it. Push it forward. Yeah. No tilting.
No tilting.
Not tilting.
Just pushing the mandible up.
Mandible up.
Pushing the mandible up.
It's like this.
Pushing the mandible up.
Yes.
Yes. Rather than doing only this maneuver, which is called chin lift, you just take care of both the angle of the mandible and push it up.
Protrude the mandible.
Just protrude.
So now next task is whenever you are in a surgery with an anesthesiologist, you are going to tell them to practically teach, and you do it whenever we are extubating the patient, right? Just put both the mandible angle, upper karo. What will happen? The tongue and pharynx will open up, separate up, and there will be enough space for oxygen to move in and out.
This movement.
Got the idea?
You can physically do it now in your patient, in the victim who's unconscious, you'll have to do it physically. This movement.
ये जो हम खुद ही कर रहे हैं ना, जो हम ये मूवमेंट अपने को करना है
ये
patient के
एंटीरियर
ऊपर।
लेके आता
एंटीरियर लेके आ सकते
प्रोट्रूजन
मैंडिबल वाले सर्जन तो कुछ भी कर सकते हैं, तो हम अमित सर को तो कुछ बोल ही नहीं सकते।
Basically, we are pulling the tongue because of the junior muscles.
Yes.
Yes.
Which is attached to the lower mandible. So when you pull it front, the tongue also gets pulled.
So this is a complete answer. Superman. Complete answer. This is an answer completely, right? Now, once we are maintaining the airway, once we are maintaining the airway in this position, here our task is not to stop CPR. I keep telling you completely, do not stop CPR and try to keep doing CPR if you are alone. When you are two people, tell one person to chin lift. If that person is educated, trained, tell them to do the mandibular lifting process. Right? If you are in a hospital setup, if you are in a clinic, if you have airways, then you put an oral airway. How many of you know how to put an oral airway? जो anesthetist putting in the OT. Please learn from the anesthetist. Wherever you go to the OT, it's a simple airway, simple oral airway. It's just a simple oral airway, plastic device. Just put it in the mouth, and it stays between the tongue and the pharynx. Nothing else. It has got no rocket science. Just put it inside. It stays between the tongue. The only thing is it has to be proper size. अगर साइज छोटा रहेगा तो ऑब्स्ट्रक्ट करेगा, साइज प्रॉपर रहेगा तो ऑब्स्ट्रक्शन खुल जाएगा, right? So there are techniques where we can put a nasal airway also, but again you have to see it once how to put a nasal airway and how to prevent the trauma by putting a nasal airway. But oral airway is a very simplest manner, or a jaw thrust is a very simple manner which you should all learn it from the many feedback. We will try on that. So.
Oropharyngeal airway, this device should be placed when the patient is conscious.
Unconscious. Conscious will not allow. He will not allow. अगर सेमी कॉन्शियस स्टेट में रहेगा तो आप थोड़ा मेहनत करोगे तो चला जाएगा, कॉन्शियस वाला रहेगा तो उठ के मारेगा। Gag reflex में then they start coughing and you will complicate the matter. Right? So now the whole question comes about the mouth-to-mouth breathing. So our Bollywood movies are responsible for this, and they all revive the patient by 1 or 2 breaths, and everybody is revived mouth-to-mouth breathing. But here there are a couple of precautions, couple of things which should be kept in mind. Number one, any strangers, we do not advocate about mouth-to-mouth breathing because of the communicable diseases. There has to be some barrier device while doing a mouth-to-mouth breathing, mouth-to-mouth respiration. If person is known to you, your son, daughter, means your children, because ये mouth-to-mouth breathing generally requires for a CPR in a child, or somebody whom you know very well, your father, mother, spouse, or somebody who is very close in your family. And if you feel at that particular moment you are doing a CPR and then I need to do something for oxygenation also, though I have teach you that if you do CPR, if you do correctly do the chin lifting, oxygenation is taken care. That day for that doctor, we have no airway devices. We had not done anything. We have done only chin lift, and we could revive him. So ultimately, your oxygenation is possible with the CPR per se physiologically. But if you feel if the condition requires, then you have to first of all see that there is no foreign body in the mouth. Say for example, vomiters or something, or say for example something foreign body is stuck into the mouth. Unless and until you are with mouth-to-mouth breathing, you will complicate the matter. So if there is nothing sort of thing, and if you really needed to do it, then it has to be first of all kept in mind that pinch the nose. Forcefully you have to blow into the mouth, so there has to be a good seal between the victim's lips and your lips. Unless and until that good seal is there, all the efforts is going to go out, not into the victim's lungs, right? And then you have to blow very strongly, 1 second blowing, 1 second hold, and you have to see the chest rise also. Now understand it is how difficult it is. It is not that easy. What movies say that it is not that easy, right? There are barrier devices like plastic covering cups, which you put on the device, so there is no communicable diseases you are facing that problem. And there is one more device which is now very popular across the world, which is called mouth-to-mask ventilation. This has got one-way valve. This mask, this the valve has got a one-way mechanism. So whatever you give will go to the victim. Whatever comes out of the victim will not go to your mouth or your breathing. So this mask is nowadays available with AED. They give it with the AED machines. So you are using this mask in case you require oxygenation of a person. So if you have this mask and if you are trying to give that, the count is 30:2. 30 compressions, your count is done, and then 2 mouth breathings, right? 32, 32, 32, you have to do 5 cycles. Correct? 30:2, 30:2. If you are 2 people, then one person is doing CPR, another is giving mouth breathing. Correct? Clear? Ratio is 30:2. 30:2. And you have to do it for 5 cycles first. What we have to do after 5 cycles, we have to judge the response of a person, whether this your 5 cycles has done something good to the person or not, or is still unconscious and is still arrested, and you have to keep continue doing it till the time we follow the certain more protocols. Right? So airway, we have done chin lifting, we have mandible thrust, we have oral airways, we have nasal airways, then we have mouth to mouth breathing, and now we have mouth to mask ventilation. Chin lift तो आपको chin lift करके रखना है, उधर आपको कुछ करना नहीं है. You are not doing anything. If you are alone, you are not going to do. Even if you are a couple of people where you are not wanting mouth to mouth breathing, or you don't have mask, you don't have a bag, then you are just putting a chin lift. Not doing
Doesn't
anything.
chin lift cause cervical?
Chin lift will not cause. It's a very gentle process. Just unless and until if you identify short cervical injury, then you are not going to move the cervical head and cervical area. Then you have to put in a collar. Somebody has to hold the cervical. And then whatever is the situation, you put in a machine on this side. Maximum effect comes with the jaw brush. Maximum effect on the jaw brush if you learn it properly. So I guess every doctor, every individual or paramedical staff should be knowing this. And and beyond this, you should know how to do the bag and mask management. How many of you use ambu bag? Ambu bag use किया क्या कभी? अम्बू बैग को हाथ लगाओ, अम्बू बैग का फील करो, अम्बू बैग को फील करो. अम्बू बैग का फील बहुत इंपॉर्टेंट है बिकॉज व्हेन यू आर यूजिंग अम्बू बैग का फील से आपको समझेगा कि हवा बाहर जा रही है कि अंदर जा रही है. इट्स नॉट ए जस्ट अ सिंपल डिवाइस, इट इज द मोस्ट इंपॉर्टेंट लाइफ सेविंग इंस्ट्रूमेंट. आज की तारीख में मुझे 25 लाख रुपए का एनेस्थीसिया मशीन दे दे ऑपरेशन थिएटर में, माय दैट मशीन हैज गॉट वन अम्बू बैग अटैच्ड टू दैट. If everything fails in the world, electricity, machine, everything, my ambu bag is the only equipment which can keep giving an oxygen to whatever the source available. The best source is an air, which has got 21% at least. So patient will not die without oxygen. May die with other reasons also, but the ambu bag is extremely important. Ambu bag and mask. I mean, only ambu bag cannot do anything because you require a mask. And mask is again the same, the mouth to mask ventilation. Here, we are not using our own energy, we are using a ambu bags used for putting a ventilation. We'll demonstrate that also during एक बार ambu bag लेके आते. One of this thing as well. भाई जाग रहे हो ना सब लोग?
Yes, sir.
So people have to keep standing, I believe, through the demonstration. So this is a CPR mask. It's called a CPR face mask. You push this out, becomes the table becomes the this I can do it on the table.
Even the ambu bags table.
This comes in a pocket. It's also called as a pocket CPR mask because you can literally carry it in your pocket like your dicky, गाड़ी को 2-wheeler dicky, 4-wheeler. You can actually carry it around with you. You open it. This is what comes out. You push this. It becomes a face mask. Okay, it's got an elastic. This triangle goes at the point of the nose where you wear your spectacles, right? So the nasal bridge, you tie this behind, and then what you do is you're going to push this mask down so that it forms a seal over the face and the nose. Okay, push it down, and then I'm using this ulna side, this little finger side to give a head tilt. Okay, then I make a pincer grasp, the chimti wala with my hand. I'm going to press the mask down and hold the chin up. Okay, and then with this movement, I'm going to bend down. Can you observe?
Yeah.
Okay, so I blow over 1 second only. How long is 1 second? 1. ऐसे blow करना है या only 1 second? 1. Right? So go up, take a deep breath, come down. That's it. Go back to chest compressions. Getting it? So 28, 29, 30 compressions. I come back, head tilt, seal, chin lift. 1, 2, go back. How many seconds did it take?
2 seconds.
5 seconds at the most, not more than 5, right? So I'm going to limit my interruptions. Sir keeps saying that chest compression has to go on and on and on. Even if I'm interrupting, it has to be less than 10 seconds. So I cannot give breaths. Like agar you can't see the chest rise. I can't keep fiddling around with my breaths. I have to go back to chest compressions. Yeah. Now this I can do alone. If I'm alone, I can do chest compressions and a mask ventilation. Chest compression and a face mask ventilation. But if I have an ambu bag, I need a dedicated person at the head end. One person will be giving chest compressions, one person will be giving a breath. So we generally have 2 people when we're doing this. Again, same thing. Face mask, triangle goes over the nose. This covers the mouth. I use something called as a C and an E technique. C for seal, and E I'll be holding the body of the mandible, and then give a elevation. Maintaining the seal, I'll give a breath. Okay. Can you observe? Can you see a chest rise? Yeah. So 1 and 2, and then one person will continue chest compressions. Then once that person counts 30 compressions are given, the person will stop. I'll give 2 breaths. Chest compressions begin. So this 32, 32, 32. ऐसे 5 cycle करोगे, so that is 2 minutes. Okay, so you have to continue doing this.
And so technique name is C and E. करो C और E करके बताओ. C and E कैसे हो रहा है? करो C और E.
Clear. And E.
ऊपर के 2 फिंगर्स है अपना अंगूठा और एक फर्स्ट फिंगर. मीटिंग है C. और नीचे की 3 फिंगर्स है वो ऐसे इंग्लिश का E. जस्ट इसको मेमोराइज कर दो, ब्रेन में फिक्स करो इसे. C और E. अच्छा अभी रेशियो बताओ कितना था चेस्ट कंप्रेशन टू ब्रीथिंग का?
30/2. 30/2.
सब पास हो गया. ठीक है. तो अभी अपने को डिनर कैंसिल. ठीक है. अभी आपने क्या किया अभी तक किया? कंप्रेशन हो गया, एयरवे हो गया और ब्रीथिंग हो गया. तो अपना जो कंसेप्ट था पहले ABC चेंज टू कंप्रेशन एयरवे C A and B. राइट. सो अगर हम कुछ नहीं कर पा रहे, कुछ भी नहीं है, तो अपने को क्या करना है? खाली कंप्रेशन. सो द फर्स्ट थिंग मैंने आपको क्या बताया? कंप्रेशन ओनली लाइफ सपोर्ट. When you don't have anything, when you have nobody, when you are alone, when you have no equipment, no possibility, still compression can win and compression can revive. Right? So what is most important? Learn compression, how to do compression, and all your anesthetists, whenever you go to the OT, try and do these ambu bag maneuvers. See any technique. Ambu bag जितनी बार आप करोगे, you will feel that. Tell them to teach you how to do ambu bag ventilation. Right? थोड़ा आगे चलते हैं. So hold the mask in technique, deliver the rescue breath, deliver each rescue breath slowly over an endpoint effective adequate chest silence. Madam ने बताया ये. We have one more advanced technique which is also we are supposed to teach you, but I guess first we will learn oral airway, nasal airway, mask ventilation with ambu bag. This is laryngeal mask airway ventilation. Extremely useful device. If you can't intubate anybody, you just have to have laryngeal mask airway in this crash cart put it on the patient's mouth and it does the magic. Right now we are not. I am not going into that detail. We will learn it somewhere some later time. Now again the question comes. Madam said 5 cycles, right? We have done 5 cycles. Now what we are going to do? Normal breathing with definite pulse. Now अभी normal breathing आ गया उसका, pulse भी मिल रहा है. So after 5 seconds, what you are going to do? Check again. Check whether you are able to find the breathing or able to find the carotid or pulse आपको मिल रहा है कि नहीं. If you find the recovery, then put in the recovery position and shift to the nearest medical facility. Now I tell you my again experience of last BCLS. We did CPR first. I got an AED. I gave a shock. He recovered. But now that's not the end. By the time I was doing something here, he again arrested. Right? So it is not necessary that once you have done this CPR and you have done that ventilation bhi ho gaya, CPR bhi chalu hai, now you got a pulse also. But there are a lot of medical conditions which can again give a cardiac arrest. Right? So if abnormal or no breathing with definite carotid pulse, then continue with the breathing. Probably you don't require a CPR at that time. But abnormal or no breathing without any carotid pulse, you have to continue again the same process. So you have to keep doing this. Now, कोई पूछ रहा है कि कब तक करने हैं? Now here the question comes, the call for help. When somebody comes to you as an expert medical advice, now the second step, by any chance you are getting an AED machine. Like I got AED machine that time. So my CPR up till now we have learned. Now the next step will go to the how we have to do defibrillation first. So all this thing is done. Madam has nicely divided. Now defibrillator or AED. Now how many of you know how many types of AEDs or defibrillator? किसको मालूम है? ओरिजिनल डिफिब्रिलेटर देखा है आप लोगों ने जो ओटी में रहता है, जो मूवी में दिखा देंगे ऐसा शॉक देते हैं, और बॉलीवुड मूवी में देखा होगा अच्छा खासा शॉक देते हैं, ऐसा 2 पैड लगा के और सब सही हो जाता है. उनका सब काम 10 सेकंड में सही हो जाता है, हमारा शुरू ही नहीं होता 10 सेकंड. Now there are 2 types of defibrillator. One is the standard defibrillator which we use in operation theatre, which has got standard pads which are connected with the proper wires, big wires, and we have to set the energy and we have to deliver. These are the ICU or operation theatre or an hospital setting. Another kind of defibrillator, automated external defibrillators. They are AEDs, right? So this type of machine everybody must have seen, but remember है कि मालूम नहीं. But then अगर आप आज के बाद कहीं पे भी जाओगे तो आपको समझ में आएगा ये AED machine है, right? AED machine is external defibrillators which are automated. Automated means we are not going to do anything. Everything is set inside the machine. We have to follow the machine. We are following the machine. Machine is not following us. Let us be very, very clear. AED machine is external defibrillator where it is completely automated. We are not going to do anything. Machine will tell us what to do. Correct? Now, once let me show you certain pictures of AED. This is the recovery position. Somebody asked, recovery position. This is the position where we are going to observe the person till the time ambulance comes. I am talking about the first set.
So he is breathing, his consciousness, everything is there.
Everything is there.
Only a recovery position.
Only a recovery position when we decided first. Right?
So this is left, right,
Push me.
So only when he's collapsed, you have to keep it in the recovery.
Now these are the machines where you may find this is a very common machine. Philips का जो रहता है वो ऐसे वाले एक केज के अंदर रहता है. Wherever they are putting in one safe place, and these are the different varieties of machine. Now lot of variety of machines are available, so don't get confused with that. I will tell you what are the basics of this machine. As a medical doctor, we should be knowing that there are VT and VF, ventricular tachycardia or ventricular fibrillation, are the conditions where shock is the treatment. Shock is the treatment. Either inside the hospital, outside the hospital. Those who are suddenly collapsed, majority of them having a VT-VF, they are treated by defibrillator. So defibrillator is a final treatment for it even if they are in the hospital. So what we are trying to do, we are trying to give the treatment outside the hospital or clinics, right? So these machines are programmed to identify 4 or 5 rhythms only. One is normal rhythm, उनको समझता है. One is asystole समझता है. Asystole means there is no activity. Then they understand VT and VF. They identify these rhythms and decide whether to be shocked or not. What are the shockable rhythms? VT, VF are the most commonest shockable rhythms. There are a lot of varieties where we do in our ICU, which is in an advanced stage. Right now, our understanding is VT and VF are the only condition where our machine, AED machine gives shock, normal machine will tell no shock, or asystole machine will say no shock. Right? This much is only period in the machine. Machine को इतना ही मालूम है, और अपने को machine जो बोल रहा है उतना ही करना है, because we don't have ECG monitor at that particular junction. So that day again in my incidents, that day again I had no ECG machine, nobody was around. We just put an AED machine to that doctor, right? So now once we see that machine, this is the machine where we have to open the machine first. The moment we open the machine and we put the power on button, we'll show you how it looks from inside. This is only one company, so this is a Philips machine, so there are a lot of models comes. So this is one machine that will be on.
Begin by removing all clothing from the patient's chest.
Right.
Clothing if needed.
So what machine said?
You can hear?
No, ma'am.
Oh my God, right.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
Clear the clothing is what he said.
Right.
Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner.
Now, what is the idea of showing this is that once you on the machine will tell you remove the clothing, and just if the clothing are not removable, they give one small scissor also.
Cut it off.
Cut the clothes, because this step you cannot do with the clothes on. This step you require this portion to
Bare
be
chest.
open, like what this gentleman is there, right? We have to open this area, right? So clear the clothings and or not possible then cut the clothes. That is what it's saying. Then what is saying that pull out the pads. These are the disposable pads which are connected to the machine. We have to get them out of the machine and
So this goes, see there are markings on the pads here. Okay, this is the right one and this is the left one. The right one goes infraclavicular, just below the collarbone. Okay. So this goes below the collarbone on the right side of the patient. Kiska
right side of the patient.
So it will be on the, see, it will be opposite to you, right? Your opposite to your left will be patient's right. And the left one goes horizontally on the left side. Okay? Below the nipple, huh?
So basically this picture shows you that how the current flows between the two pads, right? See this picture. This AED pad and this AED pad, when you on, this current flows across the heart.
Okay.
Right? Which flows in between. Like हम लोग जो OT में use करते हैं या ICU में use करते हैं. We put the two pads, right? These are the conventional defibrillator pads. Then current flows between these two. Right? There is a heart in between. Here also there is a heart in between. So madam has said that this is a heart in between, right? Here there is a heart.
Yes.
And this pads is going to give a current between this, right? So this is the concept by which machine is telling you remove the clothes, put the pads on the place, and now the next step is an analysis. Right? So again next step will be analysis.
Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
You need a bare skin. It's very clear that you know इसका जो sticking है वो
When the
चिपके
first
हुआ
pad
है.
is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place the pad exactly as shown in the picture. Press firmly to patient's bare skin.
the next step will come is an analysis. तो इसमें ये तो live है actually.
When the first pad is
Live है.
look
Trailer है, but then you can
on the second pad.
So then the next will be one.
Yellow plastic lump.
Next will be the analysis. This is a button which is I. All different variety of AEDs are there. I'll tell you about that also. You have to put that button on.
Training.
So,
A flashing blue button to choose training scenario. Scenario
right. So
1.
this once you
Scenario 2.
वो scenarios check कर रहे हैं. तो ये ड्रिलर मशीन थोड़ा एडवांस है. हम लोग को एक्चुअली प्रैक्टिकली यूज करने के लिए है वो एकदम एडवांस मशीन है. So when machine को you put on analysis, that machine will tell no shock.
Acha,
Or
it will
machine
automatically
tell
detect.
shock.
It will automatically detect
Or
what is the
machine
cause.
will tell you the shock or no shock needed. Right? So again I go back to my incident. When I applied, I asked, machine said shock. Then once the machine says shock, what you have to do is use this button. This button will start flashing. This red color type of button. And you press it, then shock will be delivered. But before delivering the shock, everybody has to shout all clear. All clear means nobody is touching the patient. Nobody,
Acha.
everybody is away. Press the shock button, machine will deliver the shock. And this shock is actually the same, 200 joules biphasic shock, which is given in the operation theatre by this machine. Right? So once all clear, shock and machine will deliver the shock. In my case, that shock is delivered, he recovered. But again he went to the arrest. So I again asked the machine after some time. Machine said no shock. Because at that time there was a rhythm. But he has started losing that rhythm and machine picked up the rhythm. The machine said no. Why I am telling you this story again and again? Machine has got a sense. Machine has got feeded data. If there is a rhythm which is not shockable, machine will tell no shock. So you are going to only and only follow the instruction of the machine. If machine says shock, you have to give a shock. Right? All clear, shock. And then again started CPR. So again, shock, whenever machine says shock, but CPR, and CPR. Continue CPR throughout the process, only those 5 seconds when machine is analyzing, you are not touching the patient, and while delivering the shock, you are staying away from the patient. These are the only 2 conditions while you are not continuing CPR, otherwise you are not stopping CPR. Unless and until person shows the signs of life.
If he recovers, then
If he recovers.
So, but right now the way you said that rhythm is falling and the machine is still detecting it, but it is not.
Not in the category of BTBF.
Yes.
ये BTBF है.
CPR
तो ये कैटेगरी जब तक रिजल्ट नहीं आएगा तब तक शॉक नहीं बोलेगा. Say for example ब्रेडिकार्डिया है. Say for example normal rhythm है, but there are abnormal still pulse is available. The machine will not say shock because it is not in that algorithm and it is not allocated in our ICU. अगर एक पेशेंट ICU में ECG लगाया हो तो we will not deliver a shock.
Okay.
The shockable rhythms are this VT and VF, which we can't identify because we don't have ECG machine. There are AED machine who comes with the display of ECG. There are AED machine who comes with the pediatric mode inbuilt without any changing the pad. There are AED machine who comes by just changing the pad, it becomes a pediatric machine. So there are n number of AED machines comes. There are AED machine who comes with a 1-year battery warranty to 5 years battery life. Because these machines are on a battery, certain high-end machine comes with the auto regulation and auto checking the machine's ability every 6 months. Like Neon Koden is the Japanese company, most advanced machine. Well, it has got so many functions that we don't really have to do anything till 5 years. But it is in the range of 1.5 lakhs times. It's a costlier version, but it has got 5 years battery life also. So we have a different variety. आपने वो 4-5 चीजें याद रखना AED का. मशीन खोलो, AED ऑन करो, जैसा उसने बोला वैसे करो. एनालिसिस का बटन दबाओ तो शॉक है देना है कि नहीं वो मालूम पड़ेगा. The moment says shock, you deliver a shock and don't stop CPR. You don't believe that shock देने के बाद miracle हो जाएगा. It doesn't happen immediately because it takes some time for heart to reframe the entire rhythm. So your CPR is very important. Say for example, आपने शॉक दिया, आपने बिलीव किया कि ये इम्प्रूव हो जाएगा, और आपने CPR बंद कर दिया और इम्प्रूव नहीं हुआ. So again you are damaging the brain by not providing the oxygen. Got my point?
Yes.
CPR तो कंटिन्यू करना ही पड़ेगा, उसमें तो अपने पास कोई ऑप्शन नहीं है अनलेस एंड अनटिल पेशेंट शोज साइंस ऑफ लाइफ। साइंस ऑफ लाइफ मतलब ब्रीदिंग आ गया, वो अभी मूवमेंट चालू हो गया, नाउ ही स्टार्टेड मूविंग हिज लेग्स एंड ब्लिंकिंग शुरू हो रहा है, ये साइंस ऑफ लाइफ भी डॉक्टर अंडरस्टैंड वेरी वेल, राइट? सो ये इन शॉर्ट फॉर्मूला।
The pads have to be kept on.
Pad has to be on the patient. These are disposable. Once this is done, once you remove, there is no guarantee that the दूसरे patient में वो कैसा चिपकेगा या दूसरी बार कैसा चिपकेगा, right? So you have to keep it over there. And if you don't require shock right now, say for example, just keep it over there. You may require it time, right? And once you remove it, you have to ask for the new pads from the doctor. You can't use it.
After how many cycles of CPR we are supposed to defibrillate the patient?
Yeah.
I
So,
was answering his question. So let me just take this question first. So for this patient, once you've applied the pads, you're going to keep this on even after the person has recovered and you shift it to a higher center. You don't remove it even if the patient has recovered. Because like sir rightly said, this person can again go into a rest. The machine will again pick it up and tell you whether shock is advised or not. Okay, so for this particular patient, you keep the pads on till the patient is shifted to a higher center where further post-cardiac arrest care can be provided, an ICU setting. So you bring the pads back only after the patient is shifted and a higher center is taken over.
So basically, even if the shock is given, the patient has not recovered and we are supposed to give the CPR again, we'll be doing it with the pads on.
Yes, yes.
Yes, with the pads on. Next CPR will be with the pads.
Yes. In fact, the pads are applied with CPR going on. Only when the machine says stop analyzing heart rhythm will you stop CPR. So the pads are also applied, so you don't interrupt CPR even when you're applying pads.
So, ma'am, so this is applied. You do CPR 30, then that again 2 is with
2 breaths. Again with everything on. See, AED is one of the safest machines. आप आपके दुश्मन को भी लगाओगे ना तो भी वो शॉक नहीं देगा जब तक वो कार्डियक अरेस्ट में नहीं है और ये वाली रिदम नहीं है जो सर ने दिखाई. Okay, so that rhythm has to be there and it is going to analyze the rhythm before it says shock or no shock. So now
so
that
you
I've
keep
applied
on
the-
doing your CPR till the machine says shock.
Stop. Still the machine says stop.
Stop.
So वो 2 मिनट का जो हम बात कर रहे थे अभी, we were talking about the 2-minute cycles, the 5 cycles, 30 compressions, 2 breaths, 30 compressions, 2 breaths, 30 compressions, 2 breaths, 32, 5 cycles. That's 2 minutes. लगभग 2 मिनट. Every 2 minutes the AED is going to stop you, analyze the heart rhythm and tell you shock देना है या नहीं देना है. Shock देने के बाद you again continue CPR. If there is no shock, if the machine says no shock, then check, मतलब response है नहीं है. If there is still no response, no breathing, continue CPR for another 2 minutes. The machine will again, like sir just
Analyze
described his own personal experience. Na? The machine said no shock, so he's continued CPR again, and after that again the machine said shock. So again the third shock was given. So this is going to continue till the person completely recovers. So his question was, do we still leave the pads on? Yes, leave the pads on till you shift the patient to a higher setting.
So we attach the AED machine even before we are starting with the compression.
How will you? You have to get the AED, right? So the first thing you do is start CPR. That's where call for help comes in. Your code blues, your call for help. What they do is they bring the AED machine later. The first thing you do is start CPR, keep the brain alive till your AED machines or your ambulances can reach you. So the CPR starts first. CPR के चलते you will apply the pads and then listen to the machine. You can stop CPR cycle midway, apply the pads. So this comes first, you apply it first. You don't wait for CPR cycles कितना खत्म हुआ नहीं हुआ. In the middle of the cycle you apply the pads and continue. Listen to the machine.
So you can do this AED machine when you're alone also, or do you need?
So India, very difficult to find yourself alone. Very difficult.
अरे लोगों को हटाना पड़ता है. अरे छोड़ो मेरे को करने दो. लोग अपने को नहीं करने देते. बोल भी देने मैं ही करेगा. अरे मेरे को आता है मेरे को करने दे भाई.
This was outside of India. Yeah, the principle is if you're alone, put your phone on your speaker phone. Call the ambulance. What is the Indian number for ambulance? 101 is fire. 112 is still under construction. I mean, it's still working. It's not yet in use. 108.
इतना बड़ा तो आपने लगाया था. सर आधे लोग ने बराबर बताया.
So you can actually do it you give first 5 cycles of CPR, bring the AED, and then you can start. So it is witnessed and unwitnessed. Very difficult in India to find yourself alone. But you can turn your phone on speaker mode, call for help, call for the ambulance, start CPR, and AED has to be available if you have to do it alone. Nearby. जो आधे घंटे दूर है तो उसको छोड़ के तो नहीं जा सकते. So if it is nearby in the premises itself, yeah. But then again, hypothetical is easier.
So in BCLS, after BCLS, when it happens in clinic or hospital, one person has to take a leadership who knows this, and you have to assign the work. That you will get an AED, you will get a crash cart, you will get an ambulance, and you will get a mama moshi to shift it. See, unless and until you decide on this thing when you are alone as a medical and the rest of the people are non-medical, it will create a chaos. So very simple, even in our operation theatre, something goes wrong. It is very important how you delegate the work. You are going to get an entropy, you are going to get an defibrillator, you are going to call the ICU person, you are going to call the other anesthetist, and I am going to continue the CPR. This is how we also behave in our ICU and we also manage, which has to be in your clinic, which is very important when something goes wrong. So one thing is very important, that what all equipment you need in your clinic, and you shortlist. Keep it at one place, and everybody should be knowing, not only you. Everybody from your staff and around people should be knowing what is the name of that particular equipment, because the funny scenario happened to me that day. When this doctor in the gym was arrested, I was shouting defibrillator. After 1 minute, I realized I am a dumb, I am shouting defibrillator. Nobody is doctor here. Nobody understands what is defibrillator. So then I told, वो लाल डब्बा लेके आओ उधर से, गेट के बाजू में. This happens to people like me after hundreds of lectures also. So it's a very scary and very high adrenaline rush scenario. It's not normal panic. It's a very panic situation. So I am shouting defibrillator, nobody understanding it. So you have to identify and you have to understand if this is the situation. You have to एक क्लिनिक में एक बंदे को मालूम होना चाहिए कि ये मशीन को क्या बोलते हैं और कब लगाना है. Unless until you do that, it is not going to be very effective, right? एक लास्ट सॉन्ग है, वो आप इसके अंदर इस सॉन्ग्स के वर्ड्स को सुनो, and the song will revise you everything, and by the time we will arrange the CPR mannequins on both the sides.
You want it here? This much space is enough.
Chair निकाल दें.
Easy guys, please come. We need to shift 2 chairs behind. Guys, slightly move behind. इसको block.